Bill, what's going to need to happen to make our hospitals more safe for patients?
In order to make the greatest amount of impact, save the most amount of lives at the least expense, the federal government has to get involved and appoint a command and control authority for medical errors.
Yes.
An application of the aviation safety model which will demand non-punitive error reporting. You're not going to be punished for reporting an error. It's like the aviation safety model applying to aircraft.
So, okay, so now
pilot,
clarify that to our audience, because, I mean, we've referred to that before, the aviation safety model. Give us just a general statement about what exactly that means.
in aviation, you're not, a pilot, as an example, is not punished for a mistake that he makes.
Yes.
Even if it results in death.
Okay.
He's punished if he fails to report the error.
Interesting.
What's important is the data that enters into the system, because then, as Claudia was referring to earlier, you can establish standard operating procedures that lend well towards reduced error rates.
Okay.
And that's how the aviation model works, what it depends upon. So you have to ensure that the errors are reported in a timely fashion with a non-punitive and actually punitive action if errors are not reported. The only way a pilot can, one of the ways a pilot can lose his license is not reporting a mistake that he's made.
Yes.
Then the statistical analysis begins, whereas the central governing authority examines the data to identify hospitals or departments or error types that have the fewest errors. They could be parasurgical errors, they could be just general floor errors, they could be medication errors. Once those are identified, then those hospitals are interviewed to identify or to determine what their best practice is. What is the standard operating procedure that produces the fewest errors? And then you transfer that knowledge to all other hospitals in the country.
Right.
That's exactly how the aviation safety model works. That's not what's being done. Instead, the governing agencies, the accreditation bodies for hospitals are saying hospitals use the aviation safety model without a central authority. Without that, it just simply won't work.
Right. Well, right. As you point out, how do you decrease these errors if you don't have that central reporting agency?
You don't.
Right.
Simply put, you will not, nothing else will work except that.